My name is Casey Arriaga, and I am a clinician here at Windmill Wellness Ranch, which is a drug and alcohol treatment center. The terms co-occurring and dual diagnosis really mean the same thing, and what they're referring to is that you have an addiction, and at the same time you also have another mental health condition. It used to be thought that this was a rare thing, or that we'd have to treat one and then treat the other one, and what we recognize now is that we really have to treat them both as primary. So it's actually very rare to find somebody who has an addiction who doesn't also have, for instance, anxiety, depression, or maybe some other things like bipolar, schizoaffective disorder, conditions that are considered to be a little more heavy, but in reality often go hand in hand. And sometimes we don't know which one came first. For instance, some people will come in and tell us, I am treating my depression with alcohol. And yet studies show that long-term alcohol use tends to lead to depression. Now that might just be because when you drink, depressing things happen. So maybe your life becomes more depressing, but also there's a fair bit of evidence now that if you're trying to treat your mental health disorder, like say anxiety, by taking a drug, then what will happen is whenever you're not taking the drug, you're going to feel more anxious than you were in the first place. So what we often find is that people are actually making their mental health condition worse with the drug use without realizing it. So they're trying to treat themselves, they're actually making it worse, and then they're really struggling when they come in. And that's why we have to be ready to treat both. So the most common co-occurring disorders that we run into are depression and anxiety. An awful lot of our clients struggle with one or both. Less common, but still really well known, would be bipolar disorder, or schizoaffective, or even schizophrenia. We run into those. Often when you have somebody who is struggling with anxiety, they will find that they're doing more alcohol or benzodiazepines or other central nervous system depressants. People sometimes with bipolar disorder will actually struggle because they have trouble staying on their medications. They miss the ramp up into their manic phase. Sometimes that ramp up feels really good, and so they may find themselves taking amphetamines or something along those lines to try and replicate that feeling that they miss when they're on medication. So we are ready to help people through all of those conditions, whether it's a combination, which can certainly happen. Often we can't really know that for sure until they get sober for a little while. And it's one of the reasons that we don't try and rush people through treatment or get them in and out in a few weeks. Because the reality is sometimes people need to be sober for a month or two before you can really see what the true mental health diagnosis is. Windmill Wellness Ranch treats dual diagnosis by looking at the whole person, not just the diagnosis, not just the mental health, not just the addiction, but looking at it all as one picture and seeing what is going to help this person most. So we're going to take the time that it needs, and we can be flexible with that depending on the person. Sometimes people come in and they say, I want to be in and out of here in 30 days. And maybe that's the right thing for them. But often they find as they're going through the process, they need a little more time. And we want to be able to allow flexibility and really have the treatment plan and the clinician and everybody's working with them on staff to fit that person, what it is that they need most. So we're going to work with medications, certainly. We're also going to work with underlying thought patterns. We're going to work with underlying beliefs. We're going to work with the family. We're going to work with every resource available, whether it's therapeutic techniques, books we can recommend, groups that are specialized for one thinking pattern or one problem or another, matching up the right clinician with the right patient to really walk them through this experience so that they come out the other side knowing that they haven't just put a Band-Aid on something, and that being sober within itself is not going to be the end goal. It's going to be a means to an end of living a fantastic life. We believe that's possible for anybody. I'll be honest with you. I have worked at several treatment centers. Every one, all the people had great intentions. We were always doing the best that we could. But the reality is we didn't always have the tools and the flexibility that we have at Windmill Wellness Ranch to be able to walk people through exactly what they need. Windmill Wellness Ranch really specializes the treatment team, the treatment care, what kind of treatment somebody gets and how long it's going to last so that we can get that person exactly what they need for their specialized case. So for family members of a client that has dual diagnosis or a co-occurring disorder, we want to let you know we're going to treat your loved one as a human being and a complete human being. Many family members have concerns that they're going to go to treatment and the person in treatment is just going to deal with the addiction. They're not going to get the mental health piece that they need. We want you to know that they're going to have a complete treatment experience that addresses everything that they need to go out and live a great life. So for anybody with a co-occurring disorder, I want to tell you first and foremost, there is hope. You are more than your diagnosis. You're not going to be a label to us. We're going to walk with you through this so that you can get to the other side and feel great about yourself and your life. That's what it's all about.